Okay, welcome back to another show. Today we're going to talk about how politicians and policymakers are so seemingly myopically focused on the virus that it's becoming more and more challenging to be healthy. We're going to talk about how the obesity epidemic might really come to grips here when it comes to the vaccine effectiveness and the immune system robustness in overweight individuals. Some research and some commentary from folks out at, I believe it was Duke or University of Northern Carolina. We're also going to talk about the vaccine effectiveness and severe outcomes. And then we're going to talk about new rules in the state of Washington, where policymakers decided that, you know what, the 6 feet social distancing bubble that we've all slowly gotten used to, well, that's not sufficient. Policymakers are now requiring small business owners and gyms starting on Monday to require a 17-foot radius around people between gyms. I mean, imagine this, right? You go to Costco, you go to Target, people buy crap all the time. I see people at restaurants with their face masks off eating all the time when I'm walking my daughter. But when you go to a gym, when you're trying to be healthy, because as we're going to talk about today, when it comes to disease comorbidities, not limited to, but including hypertension, cardiovascular disease, diabetes, obesity, all these different disease comorbidities, guess what? They're linked with increased disease severity. We're trying to prevent people from dying, not only just the virus. Friends, the virus is not the only public health issue. I know, holy cow, I said it, but it's not the only public health issue. If you look at some of the data, if you look at the CDC's numbers, which I will share with you very, very soon, I would love to share these with you guys, friends. The COVID, the SARS-CoV-2 novel human coronavirus is not the only thing that's killing people right now. There are other public health issues. So when we only focus on one issue at a time, guess what happens, friends? We have other things that are going on. So we need to be able to logically and with scientific evidence apply policies. And it's sad that policymakers are really only focusing on one thing, and that's the virus. Obviously, the virus is harming a lot of people. It's causing economic destruction. But if you actually look at the numbers, it's a little bit more interesting. So we're going to talk about all that today, friends. You know, I love to share all the science and things like that with you. And what you're going to see here on the screen is the mechanistic links between type 2 diabetes and increased disease severity when it comes to this. I know it sounds like we've been talking about that a lot. So we're going to unpack this new paper this paper right here that I just shared on my Instagram earlier today, COVID-19 and diabetes mellitus, how one pandemic worsens the other. So we're going to unpack that today. But first, let's get into some interesting world news. So this was, as I was sharing with you, the introduction. This was just posted, I think New York Post and CNN picked up the story. Coronavirus vaccine likely won't be as effective in obese people, experts say. So there were some immunologists quoted here. And I think it's important that we talk about this because everyone is seemingly banking on the vaccine. This is all we hear about. Life will not be normal until there's a vaccine. Don't expect to go to a wedding. Don't expect to travel. You can't go to Hawaii. You can't go on spring break until there's a vaccine. Well, Houston, we have a little bit of a problem because guess what? Lest I remind you, over 70% of American adults are overweight or obese. We have a major problem. Everyone's been talking about this herd immunity thing. Well, it's kind of hard to achieve herd immunity if more than almost 3/4 of us are metabolically unfit to get an appropriate immunological response from a vaccine. This is why thousands of people every year in the United States, probably hundreds of people in your state, die from the influenza virus, die from the seasonal flu, even though there's been a vaccine for a number of years. So friends, we need to double down on our health. And this is why when policymakers are getting in the way of helping people achieve health, it's kind of a problem because we're trying to help people lose weight. We're trying to help people achieve more metabolic flexibility. Yet policymakers are making it extremely difficult by adding on these new erroneous regulations and unsubstantiated things. 17 feet. So you have to be, why not 13 and a half? Why not 12? 17 feet? Okay, when you go to Costco, people are bumping into each other all over the place. I mean, you go to a restaurant, you see groups of people huddled next to each other. It's just crazy to me. So we're going to unpack some of that stuff. So here's what Mexico is doing. Oh, actually, I got to share with you. This is really funny. I saw this was shared by Chris Gethin. This is Phil Murphy here. Murphy, the governor of New Jersey. He's leading by example, as you can see here. So he's having McDonald's after a COVID-19 meeting, okay, about how to handle the pandemic in his state. Now, of course, this was an older pic. It was published or posted on his Twitter, but it's still publicly available. This is a governor of a state that was experiencing an outbreak in an infectious disease, and by that time, we had data showing that obesity, that diabetes was linked with increased disease severity, and he's taking a selfie eating McDonald's. This is a governor of one very populous state in the union. It's crazy. So what's interesting is a region in Mexico, Oaxaca, I believe that's how you pronounce that city, is banning soda sales to children. I think this is really interesting. I mean, I'm not, as many of you have come to learn over the past few months here, I generally tend to lean a little bit more in the center, a little bit more libertarian, less government intervention I think is good. But since the government is getting in our businesses and our lives, is really regulating on what we can and can't do, how much time we can leave our house, if we can go outside, all of this stuff, it's like, look, if we're going to regulate things, can we please regulate the right things? Maybe like the processed, highly obesogenic food that people are eating. And by the way, that obesogenic food that is creating these obesity and insulin resistance related diseases, guess what they're doing? They're causing people to get incredibly sick, not only just from the coronaviruses, but other viruses, from influenza. If you look at the healthcare expenditures directly linked to managing type 2 diabetes, to managing obesity, to managing hypertension, they are astronomically high. If you look at the number of sick days that obese, overweight people have in the workplace compared to lean, metabolically flexible people, there's a disproportionate number of sick days. So guess what? In Mexico, they're waking up. Look, people don't need to be drinking liquid sugar. I mean, if you want to fast track your body into being 6 feet under the ground and dying of various diseases, keep drinking sugar, friends. So that's what's going on. So it was just amazing to me, some of the comments here. People in New Jersey, when they were replying to Phil Murphy's post of eating McDonald's, they're like, yo, with all due respect, like, you're closing parks, you're telling people to stay in their homes, yet you're taking a selfie eating McDonald's and drinking a soda? Are you out of your freaking mind? I think that's absolutely bananas. So friends, let's talk about the side effects of one of the vaccines that's recently, this is it's in a phase 1 clinical trial. So basically there's 44 subjects in this group. Now, there's a lot of vaccines that are being created in tandem to try to obviously create some sort of solution for this worldwide problem. And so this company, Moderna, is in their phase 1 clinical trial. They had 2 different cohorts going through this, one in my hometown here in Seattle, I believe another one in Cambridge. Interesting things, what you need to know. So far up to now, what they published, the preliminary findings, results of this mRNA-based vaccine. So it might be kind of hard for you to see. What I can do is update the show notes here so you can see this image that I'm looking at. But they had 3 different groups out of the 44 subjects that are in this phase 1 clinical trial: a 25 milligram dose, a 100 microgram dose, and a 250 microgram dose. I had to look at my screen. Now, what you're going to see here is they spaced out the first inoculation of the vaccine. I think it was by 8 or 10 weeks. What you're going to see here after the second dose, there was fairly severe side effects, including fever, chills, headache, myalgia, nausea, all kinds of side effects. So I think, again, this isn't to be anti-vaccine, but we need to understand, friends, that vaccines are not like a free ride. It's not just like, oh, you just take a vaccine. It's just like just like a freebie. Okay. There can be complications and side effects associated with this that can be very serious, like increased susceptibility to to other infectious microbes that you didn't vaccinate against. For example, this is called vaccine interference. And we saw individuals that were in the Department of Defense. We saw that study I think it was 2 years ago, 2016, 2017, something like that, where individuals were given the flu shot and they tracked antibodies and looked at outcomes and sick days and all that sort of stuff. And there can be this thing known as vaccine-induced interference. So again, I'm not trying to say anti-vaccine. I sure hope there's a vaccine soon, because we're losing our minds. People are losing their minds. I mean, it's absolutely bananas. Now we're talking about closing schools and all of these different things. So I think it's really important that we have solutions so that at least there's not so much fear out there. But that being said, I think the best solution that all of us can embrace right now is being healthy, is eating whole real food, is prioritizing our sleep, is managing our stress, is minimizing screen time, is being with our family and our friends and not being so freaked out about this virus. Do we need to douse ourselves and take baths in Lysol? Probably not. I mean, come on, it's a little excessive. I mean, you might think I'm maybe irresponsible for saying this. I haven't bought hand sanitizer this entire year. We haven't in our family. We barely. Call me crazy, but we're not, we're not like these clean freaks. We're washing our hands every 10 seconds. We don't even own hand sanitizer. Now, my wife at her office, she adjusts patients. In between each patient, she's wearing a mask, hand sanitizer, all that. My daughter and I, when we go back from the store, sometimes we wash our hands, sometimes we don't. It's just, I think there's something favorable to having microbes on our skin. So anyway, let's get into the topic at hand here. Call me crazy, but yeah, I think there's iatrogenic effects we all need to consider. Okay, so here we go. This is the story of the day, story of the week. It's been making headlines all over the place, and I don't understand I would love to know. Governor Inslee, he's the governor, the good old Inslee from Washington State. He has a new mandate, and his mandate is that gyms in the state of Washington, starting on August 10th, instead of the current recommendations of 6 feet of social distance between patrons, gyms and facilities in counties in phase 2 and 3 of these states in the COVID-19 economic reopening plan are now required to provide 300 square feet, about 17 feet of distance per patron. 17 feet. So imagine if you're a small business, a yoga studio, and your overhead is $10, $12, $13, $14, $20,000 a month. Okay, let's just consider the basic finances here. It's damn near impossible to just cover your overhead having these crazy, unsubstantiated, unscientific based. There's been no new study that has shown that, 17 feet's a magic number. And by the way, if this is the case, why hasn't Fauci, why hasn't Deborah Birx been talking about 17? Why was it 6 feet when it was really 17? So if this is now the case, that we all need to be separated by 17 feet, okay, the people that came up with the 6 feet, they need to be fired or replaced because obviously they're incompetent. So I just literally, I get fired up about this because I have good friends who are losing their asses as business owners, as gym owners. I have clients who are overweight. I have people that have their diabetes, pre-diabetes, their metabolic health, their depression. Everything has gone sideways. Their only outlets, we're going to gyms, we're going to fitness studios. Some of these people live alone, guys. Not everyone has 13 kids, okay? But some people live alone, and their social outlets are going to the gym, going to the yoga studio, going to Pure Barre, going to Pilates. And now the government is intervening so hard. Yet you can go to McDonald's, you can go to Wendy's. There's no limit on how much vodka I can buy or how, I can stand within 6 feet of someone at the liquor store and buy cases and cases of liquor. No one's going to stand. I can go to Dunkin' Donuts and buy as many donuts as I want. And I can go to a restaurant and have as much dessert as I want. But to go to a gym, now new recommendations are 17 feet of distance between people. Really, when is the madness going to stop? What new data is this? I mean, the thing is, friends, if these people cared about our health, we have tons of data that we've covered on this channel. We have ample data that we've talked about since March. Fasting glucose elevations, glycemic variability, obesity, chronic inflammation, hypertension. Okay, what does exercise do for all of those comorbidities that I just mentioned and all those health effects? It improves them. You know that. Yeah, so if our policymakers care about our health, why are they making it so difficult to be healthy right now? It's crazy to me. It's absolutely crazy. So friends, if you want to get involved and help with this madness, I call it madness because it's madness. It seems like irrational madness. There's a petition. There's going to be a link below. I would love for you to sign that, to share that, because what's going on, friends, what you see when the state of California does something, the state of Washington does something. When the state of Washington does something, the state of California does something. And then when one state sort of sets a precedent, guess what happens? all the other states generally tend to follow, outside of the governor of South Dakota, which she kind of does her own thing, which is really pretty interesting. She's got some big kahunas, but this is, we're seeing crazy things happen. And it's unfortunate because here's this petition, and we're going to talk a little bit more about that. Let me just drop this screen here. Okay. So friends, the loss of life years associated with going out of business is very challenging for the individuals. If you want a world where the only stores that are open are Target, Costco, McDonald's, Starbucks, that's where this thing is going. If the government keeps getting in the way and shutting down and making it very hard for small businesses to run and making crazy rules for restaurants operating at 25% capacity, doing all this sort of stuff, business becomes not sustainable. Businesses need to make money in order to pay their overhead and their bills and their employees and to buy new inventory and to pay taxes. As a business owner, I've been a business owner since 2007. There are a lot of costs, right? And it's crazy that the government has barely regulated Costco, hasn't done much for Target. There's people all over the Target. There's people all over Costco. And it's really unfortunate that we know that being healthy is a priority. Now, look, friends, people don't have to go to the gym. You don't have to. If you're scared of going to the gym and you have a home fitness studio, then fine, whatever. But if you live alone and the only place that you can go to connect with other people is going to the gym, why are we making it so difficult? It's crazy. So I would love for you to support my friends, Brandon and Sammy Sweeney. Links are below. Just sign the petition and just help spread awareness to other people. And you need to realize, friends, that when people have worked their entire lives to create a business that helps other people, and the government is blocking them from helping those other people, not only does that directly impact the families of the business owners, but that impacts all of the surrounding people that were patrons of that business. Small business is what makes America great. And our politicians are totally intervening. McDonald's never had to shut down. Kentucky Fried Chicken never had to shut down. Costco never, Target, nothing. None of these people never had to shut down. They changed a few policies, but it was only the small businesses. And they're already hurting because now people are scared from all this sort of stuff. And then there's new rules and regs. I mean, it's just really, it's crazy. I really feel for these people. And, so I'm going to take some of your questions, but I get passionate about this as a small business owner myself. It's really, really challenging, friends. So I think we gotta spread the word, and we have the data. So here's this petition here for just fair treatment for yoga studios. I don't know if you've ever been to a yoga class or you like yoga. Yoga can be yoga has changed my life. I mean, when I hurt my back in college in 2002, yoga literally changed my life. If it weren't for yoga, I don't know where I'd be. I'd be crazier than I am right now, if you can actually believe that. But yoga is a phenomenal way, and the government is making it so hard for people just to go to yoga. I mean, we need these places to live, friends. So please support my friends below, and also consider supporting your body's metabolic health and your longevity. We have a great new longevity bundle that features berberine hydrochloride and micronized DHEA in different milligram dosages. So these are two of my favorite all-time natural compounds. Berberine hydrochloride is one of these natural compounds that, friends, it really, really works. So if you're into fasting, if you're supporting your metabolism with a low-carb ketogenic style diet and exercise, you would really benefit from berberine hydrochloride. So you can support your body's health and your longevity by checking out this bundle. Links are below. You can use the coupon code HI8 at checkout over on our website, myoscience.com. That's MYOXCIENCE.com. Again, that's myoscience.com. Okay, let's get to some of your questions. How was that? Is that all right? We have a lot of people that disagree with stuff that I talk about now, which is really interesting. All right, let's get to some of your questions here. Here we go. Okay. Elizabeth says, Moderna and Fauci are linked. He will profit. Probably, who knows? That's crazy if that is the case. Okay, Shirley said, we should regulate who is allowed to fund the people who decide what's in the dietary guidelines. Yeah, we totally should. Because, friends, all of that is impacting our health. The majority of the people that are sick in, that are sick in the ICU and the hospital from this virus and others, guess what? They have diseases caused by eating that crap. Okay, Rosalind says, did they publish the ingredients of this vaccine? Yeah, it was just the mRNA and water. So there's not a lot of negative, yucky stuff in there. But that's a good question. There sometimes can be adjuvants that stimulate the immune system that cause issues. Fast Eddie says, COVID-19 is event 201. If you don't know what 201 is, you deserve forced vaccinations. Got it, buddy. Yeah, I'm it's crazy, man. It's crazy. Joshua Webb, what's going on? Joshua says, actually, with this current COVID-19, people had a history of flu shots are more susceptible. Joshua, can you please send me an email? Do you have any data on that? I've been trying to find research on that. I haven't been able to find anything conclusive. I would love more information on that. Elizabeth says she refuses vaccines. Okay, where are we at here? Yeah, same. No hand sanitizer. Whatever happened to regular soap? Yeah, I mean, I'm surprised we haven't gotten it, to be honest, because I'm not trying to get it. I wanted to. I was telling Deanna, but then there was all these complications with our business and what would happen to her practice if I got it, because then she would have to quarantine. But you know, we're not clean freaks with our washing our hands every second. I see people in their car with hand sanitizer and all this sort of stuff. I mean, it's crazy to me. Larry Diamond says, me neither. We combine it with thermal receipts. Bad news. Yeah. So, Miss Casey says, I love my gym. It's my lifeline. Yeah. The gyms are important for people, man. And we're just making it really, really hard. So friends, please sign that petition below. Yeah, we're getting a lot of great comments here. Yeah, it's crazy. All right, so guys, as always, thanks for hitting that like button. Thanks for being a part of this community. Since I got quite a few of you on here, you might need to know that that YouTube is censoring a lot of our stuff lately, and so I'm still pumping out videos, but it's becoming unmotivating knowing that our reach compared to what it was just even in March has gone down so much, even though we've continually pumped out content. So I just want to say thank you for being here. Thank you for hitting that like button. Your subscriptions, your comments, like if you see a video come up, if you just do it, even just a quick comment like, hey, thanks, or cool, whatever, that actually really helps the algorithm, because something is fishy going on, and I just want to make sure that we're able to continue this, because it's been a good ride. We've shared a lot of content. I love connecting with you guys and doing these interviews and everything like that. And I would hate to see it continue to go down, because if it continues to go down, it's going to be hard to continue to maintain this. So just wanted you all to know that I really value any quick comment, any likes, subscribes, shares, all of that stuff, to tell the algorithm that that things are good, because something has changed recently. It's not just me; it's happened to a bunch of other health people that I've been talking with, and it's weird, it's crazy. I don't know what to make of it, but anyway, friends. Appreciate you being here. Hopefully you have an awesome rest of your day. What I'm going to do is just go back and update some of the science we talked about in a blog post and summarize some of that, especially this study right here. Really exciting stuff about the connections and the molecular connections between COVID-19 and diabetes and much more. So appreciate you being here. Thanks for joining us on this crazy ride that we're on right now. Have a good rest of your day. Catch you all soon. Bye.